Joining us now to discuss is Dr. Jason Wilson. He's the Associate Medical Director at Tampa General Hospital Emergency Department. Good to see you, Doctor, and thanks so much for coming on. Overall, how much of a game changer is this agreement between the United States and Pfizer and this new deal that was finally reached this morning to get 200 million doses, 100 million extra by midsummer?
This is a great deal for taxpayers, and it's great for people who are waiting for the vaccine. If you remember, Pfizer didn't take any federal money to develop this vaccine. They really went out and on their own, they got a contract with the federal government to say, we will buy it if you're successful, but went out on their own and created this vaccine. And once it was created, then sold it to the, the federal government, these doses. And so now we'll start to see, 100 million more doses, which is 50 million vaccines. Remember, it's a 2-dose vaccine, start to move into the market. So this is great news. Of course, the only challenge with the Pfizer vaccine is we've got to have somewhere to store that vaccine at negative 80-degree temperatures.
Yeah, and I think a part of Operation, I know what you're talking about with Pfizer being different than Moderna as part of Operation Warp Speed, but this, as far as storing it, it appears that they have the facilities to do so, that the government is taking control of that situation. So what great news there for those that want to get that vaccine hopefully more readily available. Talking about that, Pfizer's vaccine is already, though, being rolled out across the country, as you well know, for emergency shot use authorization that happened by the FDA. And in fact, a couple of top U.S. officials like Dr. Anthony Fauci, Health and Human Secretary, Services Secretary Alex Azar, they rolled up their sleeves. They got the vaccine. But bottom line, when you see an official like that, even someone like yourself, sir, do you think that helps boost confidence in getting those first doses of the vaccine for the American people?
I do think it helps. I got my vaccine last Tuesday. I put an op-ed out in our local newspaper, talking about my vaccine experience. I think we have to have a persistent, consistent message that this appears to be a very safe vaccine from the available data. And people who are working in healthcare right now who know the most about this science, including people like Anthony Fauci and other people who know this science very well, are willing to get, first in line and take this vaccine.
Alex Azar made some shocking comments not too long ago on another network about what hospitals are doing with their supplies of life-saving drugs like Regeneron, those therapeutics, and convalescent plasma. In a statement yesterday, he said hospitals across the country are not using them. Is that accurate at Tampa General or other hospitals you've heard of? What do you make of that?
We are trying to use every available therapeutic modality we possibly can for our patients. Now, this does present some interesting new challenges. Remember, these drugs are becoming available often as emergency use authorizations or as research drugs very quickly. And it's, requiring a number of teams to work together that may not have ever worked together before, and for types of drug delivery to happen that maybe haven't happened before. A great example of this are the monoclonal antibodies. These are the like the Eli Lilly drug and the Regeneron cocktail that received FDA emergency use authorization about a month ago. These drugs are IV infusion drugs, so you have to start an IV and drip the drug into the body as an outpatient, not in the hospital. And so for us to store the drug at the hospital, we have to find a way to link patients to that medication somewhere in a clinic, somewhere outside the hospital space. So those things create challenges even for a big healthcare system, like Tampa General Hospital. We're able to do that, but it takes a little time to work those kinks out. And I think that's why we're seeing some frustration in terms of just how quickly we can move from an idea or the laboratory to bedside. But overall, if you look at this, when we didn't even know this virus existed a year ago, that we've developed remdesivir, using dexamethasone, have a vaccine, and have monoclonal antibodies all within this space, it's pretty incredible.
Dr. Deborah Birx, I want to talk about that. She recently, said you shouldn't travel for the holidays, but then she was seen traveling for the holidays, and now she's considering that she may resume her post in the next administration. Listen to this.
I will retire. I will have to say, as a civil servant, I will be helpful through a period of time. And then I will have to say that this experience has been a bit overwhelming. It's been very difficult on my family.
Does that surprise you, sir, just being in the medical field, in hearing that from Dr. Birx?
Well, I think it's important for those of us who make healthcare decisions to also walk the walk and talk the talk. There's a famous picture of Anthony Fauci out there in an Ebola suit, seeing one of the first Ebola patients in the United States. I think it's really hard to ask, people in healthcare to do things that we're not willing to do, or make sacrifices that we're not willing to make sacrifices for. So my Christmas looks very different this year, and I'm going on, any space I get and telling people, please try not to travel and to stay in your family units, so certainly I can't, go against that. And it is difficult, but it's difficult. It's much less difficult for me than it is somebody who is struggling to make ends meet, or maybe is, not able to work at all right now because of, the restrictions we've had to have because of this, horrible pandemic.
All right, Dr. Jason Wilson of Tampa General Hospital, thank you so much for your time, and Merry Christmas to you.
Merry Christmas. Thank you.